Hi, Dr. Kunst. I appreciate the opportunity to be here. Carla Peron, the Chief Medical Officer for Philips. Do you mind introducing yourself?
Sure. Thank you very much. My name is Dr. Kunst. I'm Associate Professor at Lahey Hospital Medical Center. I'm also the Neuroradiology Section Head. We are located just north of Boston in Burlington, Massachusetts. We are a Level 1 trauma center, a comprehensive stroke center, and we have a thriving neurosciences division treating an adult patient population.
Amazing. We know that the number of patients with neurological disorders is rising rapidly, adding burden to already very kind of much in trouble system in the US and globally. Do you mind sharing a little bit your experience and how this is impacting you and your staff?
Sure. I think in part it's because of improved diagnosis. I think people, and now there's of course the explosion with a lot of therapies that are now available. So people are now getting inspired to have their diagnoses established and follow through on treatment. We have an aging population. We have about 3 million people diagnosed with Alzheimer's in the US each year. Before, it didn't have a lot of clinical utility in diagnosis because there weren't any treatment options, but now that's changing. So it's a very hopeful time to be in neuroradiology and kind of see all of these treatment options arising.
And how the technological advancements is actually helping to kind of overcome those challenges of having more patients coming into that funnel?
Sure. Well, we've been able to kind of dedicate and streamline some of our protocols to make sure that we're optimizing the imaging for Alzheimer's in particular, and then for multiple sclerosis. We're seeing a large volume of patients that are coming through, and it's not just because of the improved diagnostic quality, but it's also just we're seeing volume increasing across the board at a time where there is a shortage in radiologists and technologists and IT specialists. So we really are looking for technological advancements that make us more efficient, that improve diagnosis, that allow us to diagnose more people accurately and quickly. So, there's a number of technologies that are being implemented. We can improve efficiency in our MR sequences and just make them faster and better. We have a number of AI applications where I work that are not just pertinent to Alzheimer's and MS, but also for kind of stroke diagnosis, aneurysm detection. So things that are running in the background that kind of serve as safeguards that we're not missing some key features of an exam, but also that allow us to be a little bit more targeted and hopefully faster in our approach. We have some generative AI tools that help with report generation, so we are getting a little bit faster.
And how do you think AI will play a role in the future, specifically for Alzheimer and MS?
I think it has a tremendous impact to change and improve our diagnostic capability. So for Alzheimer's in particular, now that there are treatment options available, Alzheimer's is in part an MR heavy diagnosis in terms of for imaging, but really for Alzheimer's, typically MR was being ordered to rule out other disease pathologies that could mimic dementia, right? But now there's more of a rule-in feature with MRI. So we're looking at volumetric analysis to look for specific patterns of atrophy that might make Alzheimer's more likely, but that's you want to start these therapies in the very early stages of the disease, and typically that volumetric, that pattern of volume loss is more in the advanced stages. But nonetheless, I think with lecanemab, you have treatment options that have some side effects, right? And that can produce edema or that can produce hemorrhage. So some of the tools that I see coming out there allow for worklist prioritization so that these patients that have these complications get prioritized and get diagnosed more quickly. So that's for Alzheimer's. For MS, I mean, the patients are complicated. They can have a tremendous lesion burden. And so what we're doing is just following patients case to case. Which can be just exhausting after reading a bunch of these cases for the day. So if you have an AI tool that kind of matches one scan to the next and allows you to pick up subtle changes in lesion volume or a new lesion, that's very helpful.
So a huge opportunity to improve patient outcomes and to be more precise,
yes.
Right?
Yes.
Perfect. Thank you very much.
Thank you.